All right. Hello, everyone. Welcome to the Gluten-Free Expo Vancouver. We're so excited to be here and see all of you here. My name is Cindy, and I'm one of the event organizers of this. So we've been on a hiatus for 2 years because of COVID. So I'm sure a lot of you have been itching to come back to this expo, and hopefully you've been able to walk around and try all the samples, get the ice cream sandwiches. I saw everyone was carrying one around. Of course, we have a bunch of speakers today, and I just wanted to thank some of our sponsors for making today's event possible. Our title sponsor, Promise Gluten-Free. I'm sure a lot of gluten-free eaters already know who they are. They have breads, cakes, muffins, all sorts of baked goods that you can find at grocery stores. If you haven't seen them yet, they're right at the entrance, so you can sample a lot of their products, their new products as well. Then we also have a new sponsor this year, our title sponsor, Nima Partner, which is a really exciting company because they have a technology where they have a pocket-sized gluten sensor where you can bring out when you're eating, you can just put the food in that you're about to eat and test if there's gluten in it, and you'll get the results within minutes. So it's a really, really innovative product out there. So definitely pass by their booth and learn more about their product. What a time to live. We have so many vendors here today. Being gluten-free is no longer as hard as it was, 15, 20 years ago, even 10 years ago. It's really come a long way. This weekend, it really is a testament of how far we have come to facilitate the gluten-free life. Whether you're celiac, gluten intolerant, or simply just living the gluten-free life, it's never been more exciting and with hundreds and thousands of products for you guys to eat. So today at the Convention Center, we have lots of passionate and talented individuals who are behind the products. They're at their booth, so definitely chat with the owners, the people who are behind the products, and learn more about all the goods that they have. And most importantly, you can sample them. Try before you buy, right? That's always fun. So make sure there's lots of specials. The vendors are offering special pricing at our expo especially, so make sure to check them out. And speaking of chatting with the teams behind, first off, we have one of our exhibitors at booth 609, Mariana Reis, here today to share her knowledge with us. She's a certified holistic nutritionist. She specializes in women's health, fertility, and prenatal and post-natal care. She also follows a vegan and gluten-free approach to her recommendations. She offers one-on-one meal prepping, workshops, and one-on-one coaching, which I mentioned already. With her practice, she hopes to help lots of people live better lives, prevent the onset of most common diseases, and improve the lives of people going through life challenges. So let's welcome Mariana and give her speech.
Yeah, now it's working. I pressed a button that I shouldn't press. It started well already. Thank you, Cindy. Thank you, everyone, for being here with me. So Cindy already gave me a pretty good introduction. So I started my career in nutrition after I moved to Canada many years ago, and was a process of understanding food and getting passionate about it. We passed through many difficulties adapting to new diets, and knowing how that was a struggle for me pushed me even more to start helping people going through the changes as well. Including or removing food and changing the way you eat can be a very challenging process. So that's one of my passions, help people going through this process to have lifelong changes that helps them being healthier and have better well-being. So today, I'm going to talk about how celiac disease influences women's health and pregnancy. Of course, this is a topic that not all the time we talk about when we are going through those changes. So women in the audience who are mothers, can you raise your hand and tell me if at any point in your life, if you're struggling with something, anyone pointed out that diet or gluten could be an issue right out of the bat? Okay, got one over there in the back. And her too. Okay, that's promising. Yeah, okay, yeah. So that's changing, but it's still like a minority, right? most people, they go through like life having problems like painful periods or the onset menarche that comes a little bit too late or like endometriosis and other issues. And it can be related to how you eat, but it's masked in other symptoms and people usually don't get tested, right? So that's the whole topic of my talk today. So yeah, everybody here who is celiac knows what gluten is, or at least is familiar with that. So that's no news, right? It's a protein that's in wheat, it's in rye, it's in many cereals that we eat, and they're exposed almost every day, right? And for people who are sensitive or are celiac, it can really trigger inflammation in their bodies, especially in the gut. And that inflammation can become chronic and can lead to several other conditions. So this is a little bit of a list where gluten can be found. So pretty much almost everywhere. So luckily, we are here today in a space where we can see that, as Cindy said, it's not as hard to get gluten-free stuff that is actually tasty. I remember when I was growing up and people would like, oh, I don't eat gluten. And I'm like, oh, so sad for you because you only have like crumbled muffins and the things that are not tasty at all to eat, right? But it's not true nowadays. So things are getting better and people are more aware and people are getting the help that they need, but there's still a lot to go through. So celiac disease is an autoimmune disorder that affects people who have a gene for that. So it can pass from generations and can be activated in some of our children, right, or not. And not everybody will show symptoms, but for those people who show, they will react consuming gluten, and that can cause severe inflammation, which gradually will destroy the lining of the small intestine. And the small intestine is where we get most of our nutrients from. So like 90% of the nutrients that we get from food, we get from our intestine. If your intestine is inflamed and it's not working pretty well, then we can get malabsorption of the nutrients, which can lead to many sort of health conditions. So this is how the normal feeling of our gut should look like small, tiny little fingers, and they grab the nutrients and help absorbing it. If it's like flat, like this, like on the bottom graphic, then it's not grabbing the nutrients and just passing through it, and we are missing most of it. So the damage really can cause malabsorption, which can lead to several conditions, and that can go through like low energy levels, go through hormonal imbalance, a lot of headaches, even I'm going to talk a little bit later about like how it can impact even fertility for women. But a lot of these can get misdiagnosed because you can like, oh, I have a lot of headaches. For how many years my doctor would just tell me to wear glasses, right? And almost never someone would say, hey, check your diet. So some of the symptoms that people can have, anemia, deficiency of vitamins, abdominal bloating. This is classic, right? It's one of the things that will sound a red flag. Is like, oh, you're bloating, you're gassing. And of course, like diarrhea and constipation, but you get like headaches, you get mouth ulcers, you can get swollen ankles. So it's a lot of conditions that we don't actually think about like connecting with gluten and celiac disease. So what about celiac disease in women, right? That's what I came here to talk, not to teach you guys about celiac disease. So it can cause abnormalities and conditions associated with the sex hormones. So whenever the gluten can attach to our cells and can attach to to how we produce hormones. So it can trigger like the production of more progesterone or more estrogen, or even can trigger the production of more prolactin in a woman. And this all can damage how our cycles work, right? So because our cycle is very sensitive, it needs to go in a rhythm. Anything that happens that can cause imbalance can actually lead to maybe even infertility, right? So people who take like too long to get pregnant or has like too long of a period or too small of a period, they are not ovulating. Maybe it's because gluten is causing that inflammation and that triggering the production of too little or too much of some of our sex hormones. So some of the conditions that we can see, infertility, PCOS, PMS, headaches, low libido. So for women, especially if you have like too much prolactin, I went through this myself right after I have my kid. I was breastfeeding, my prolactin is up to the roof, low libido. So women know. Some of them, you who had kids, you know. But imagine that even if you're not pregnant and you're dealing with that like throughout your life, right? Without getting a proper diagnosis. So some reproductive changes. We can get delayed onset of amenorrhea, which is the disappearance of period altogether, so you don't have your cycles. Early menopause, recurrent abortions, and that we're going to talk about it in the pregnancy section of this presentation. But it happens because the protein and our immune system can start targeting our placenta and our endometrium. For men, they also, so the men in the audience, you're not forgotten, right? They also can affect your fertility too, right? Especially when you're not absorbing zinc. There are so many studies connecting the zinc in your bodies with the amount of healthy sperms that men make, right? So without healthy sperms, you cannot make babies. So you can get like a low count of sperm or problems with their motility. Alterations in pregnancy. So it can trigger miscarriages. It can impact premature delivery of the babies, impact fetal growth. So again, if you're not absorbing the nutrients, that can, of course, impact how you are transferring these nutrients to your baby too, right? How you're in uterus, like feeding your child if you're not getting these nutrients. There's so much that the child can steal from you, right? Because it will. But if you're not replenishing it, then it starts getting very hard. The hormonal and immune changes. So what happened when we get pregnant, right? So the only way of treating celiac disease is by removing gluten off the diet. So there is no drugs or pharmaceuticals that will help you with that. So the best thing for you to do is if you're not diagnosed and if you feel that you might be celiac, or if you have celiacs in your family and you are planning to get pregnant or you are pregnant already, it would be nice to go to your doctor and ask to get tested, right? Just to make sure that you have the tools in your hand to have a good and healthy pregnancy. Because as I mentioned before, it can trigger a lot of unwanted results for pregnancy. Uncontrolled celiac disease can lead to miscarriage, preterm labor, and problems with the child. But once it's under control, your risks are pretty much the same as everybody else. Even people who are not celiac, if you're controlling it, you have the same risks as everyone else's. So again, it's easily mistaken for other conditions. So people are not actually tested and treated on time. So they're usually going to go and treat it after they are dealing with some sort of conditions for many, many years. Or they decided to go more natural. Oh, I'm going to talk to a naturopath or someone else because I just tried everything and I just can't get pregnant. Or when I get pregnant, I keep losing the baby. And so that's when usually it gets tested. And then that's why celiac disease is important to get tested even before. So again, talking a little bit more about the nutrients that are important during pregnancy that we might not be getting enough, because it doesn't matter. You eat, but you see, like here we have like a lot of good vendors and serious business, and we see like this is flourishing. But you go, even if you go to the grocery store and you eat a lot of good food, organic, whole foods, we know that our soil is not the same anymore. You know that maybe you're not getting the nutrients that you used to get 50, 100 years ago, even when you're eating very clean. Can you imagine if your guts are not doing their job because they can't? And the nutrients, the little nutrients that we get are just going through, and you're not getting it. So then how are you going to sustain a healthy pregnancy like that? So here's other complications. So as I said, the antibodies that target the protein in gluten, they can bind to the placenta and damage it. So that's why people that are celiac and are not treating it, because they don't know, they are at more risk of miscarrying. Another thing is that it can also cause damage of the endometrial line. So the endometrium is the wall of our uterus, and every time we have our periods, it prepares to receive the baby, right, the fertilized egg. And the egg attaches to that lining of cells. But if the lining is damaged, the egg may not attach, and even if attach, it might not be a very hospitable environment for the baby. And then that's when women can get miscarriages. So that's just two other reasons why we need to investigate deeply. So a few nutrients that we need during pregnancy that might be not well absorbed if you're celiac, and there's some places where you can get them. So once you treat your celiac condition, it's nice to have like a follow-up with a healthcare provider. So you can add the right nutrients to your diet and supplement with supplements that are gluten-free and that are appropriate for you. So again, calcium, vitamin D, magnesium, omega-3s, they are all found in food, and there are a lot of sources of food that are naturally gluten-free. So just having a deep conversation with your healthcare provider will help you get all of that from your diet, and if not, from proper supplementation. And again, for those who are parents or planning to become parents, it's a concern. If you are celiac, will my kid be celiac? There is a chance, yes. 1 in 10 kids, if one of the parents are celiac, they can they can develop celiac disease themselves. If you are concerned about the health of your kid, check for some symptoms, and of course talk to the pediatrician, to your physician, nutritionist, and see if there is a way to get your kid tested. If they keep having vomiting or bloating, if they show signs that they are not growing properly because they are not getting the nutrients that they need, so it's better be safe than sorry. And make sure that you rule out celiac disease from the beginning, because they could be dealing, like ourselves, with many, many, many conditions without even know that's related to this, sensitivity to gluten. So again, Only 100% gluten-free diet is the treatment for celiac disease. So the earlier you discover and the earlier you start treating it, the better. For people who are celiac, food is not only the only source of gluten. I just want to mention it here. That's some cosmetics, cleaning products, and even like the supplements that we buy from our health food store. A lot of them, they still contain gluten in it. So reading the labels is the best you can do. And just make sure that you're getting the ones that are gluten-free and appropriate for you. So for women who are planning to get pregnant, we usually recommend that you talk to your healthcare provider or nutritionist. Just get information at least 3 to 6 months prior of like getting pregnant, so you can prepare your body. So make sure that if you discover now that you're celiac, that you can start treating it and getting the nutrients that you need, so your body is in the optimal position to conceive and generate a baby. And for those who are pregnant, it's very important that you get that follow-up and the meal plan that's designed specifically for you. So you're not missing that important nutrients, and that both mom and baby are healthy, and also that you're prepared for after birth. Post-natal, it's very demanding on the woman's body as well, especially if you're breastfeeding. The baby still suck the life out of you if you're breastfeeding, and if you're not getting the nutrients that you need, you can lose a lot of weight. It can put the mother under a very bad situation. So having the follow-up with your nutritionist, make sure that you're getting all the nutrients that you need, it's one of the best approaches for you. And so this is all. I'll be here for a little bit if you have any questions at all. I'm also at the booth 609. If you are shy and don't want to ask it out, you can come and visit me.